Hi, I'm Frank Diamond, Managing Editor of Infection Control Today, and with me today is Mary Jean Ricci, the newest member of our Editorial Advisory Board. Mary Jean, thank you for being with us today.
Thank you, Frank, for having me.
Now, what is your background?
I've held many administrative positions in nursing. Currently, I'm the Director of Clinical Education at Drexel University. I am an assistant clinical professor, and I also do nursing supervision at Fox Chase Cancer Center in Philadelphia.
And I know we're just talking that you've been working some long days these days, as a lot of people in healthcare, right?
Yes, we're on Zoom many hours a day, as everyone is, because unless you're an essential worker, you are working from home during the pandemic.
You have a pretty back, good background in infection prevention, Mary Jean.
Yes, I was the Director of Education, Quality, Regulatory Risk, and Infection Prevention at Good Shepherd Penn Partners. And throughout my entire career, I was always gathering data for either quality or infection prevention.
Obviously, I'm not going to ask you, have you ever seen anything like COVID-19? Because nobody's ever seen anything like COVID-19. But what would your advice be to infection preventionists who are out in the field doing, helping patients with COVID-19?
My biggest advice would be just remind, you're asking me patients that there's two things. My biggest advice to infection control practitioners is just to remind employees the importance of hand washing, but more so what I see in the hospital in various settings, and even on television, on the news networks, people are touching their mask, people are taking their mask off. I would remind infection control practitioners to remind staff to not touch their face, not touch their mask, because the minute you're doing that, you're contaminating your mask, and to be very careful when you're donning and doffing the mask. Now, as for patients, I would remind patients when they're in the hospital to remember that all the surfaces may be contaminated, to basically try and remain in your room unless you're mandated to uh, ambulate in the hall. And if you're ambulating in the hall, remember you should have a mask on as well.
In your experience with infection prevention and infection prevention departments, what's the best working relationship that infection preventionists can have with staff? How does that work?
Well, when I was at Good Shepherd Penn Partners, we actually did all of our own education. I had a colleague by the name of Suma Chaco and I believe she's joining the advisory board as well. Um, we went out to the staff and actually did all of our own education. So our relationship was very good. I had the pleasure of also being the privilege of being the director of education as well as in charge of infection prevention. Therefore, the staff saw me on a regular basis, so I was able to combine mandatory education with our infection control practices.
Is it a bit of a balancing act way infection prevention for the staff and infection prevention for patients? And how do you work that out?
Well, I think until COVID came out, there wasn't as much emphasis on educating the patients unless it was something like washing your hands with C. diff if you were discharging a patient with who was going home with C. diff, and the importance of, bleach kills the spores and things like that. So it was individualized attention with patients. Now we're looking at it from a global perspective that every patient needs to be educated because this is a novel virus, and it is unknown. And I think the fact that we don't have the same symptoms developing in patients, that we're having everything from the typical fever, cough, which of course mask, hand washing and all would be great. The other thing is people are touching their eyes and all, and now we have the pink eye like syndrome that people are getting. So we have to educate them on that. And some of these lesions that are coming on people's fingers and toes, as they're calling it, the COVID toes, trying to remind patients that should these develop when they go home from the hospital, please treat it as though it's contaminated. So if you touch your toes, make sure you wash your hands again and things like that.
For healthcare workers, especially, hand hygiene has always been a problem. It's been, it's I have to tell you, you know better than I do. I don't quite understand why. I mean, it would seem like it, at a certain point it becomes second nature, right?
Right. I don't understand why people don't want to wash their hands. I'm very conscious of washing my hands. A number of facilities that I go to on a regular basis have badges now that track people's hand washing habits. So if I have my badge on and I go into a room and I don't use the Purell or I don't wash at the sink, it's recorded as I didn't do hand hygiene, and that report goes to a supervisor. So we have the technology that would let us see who is or isn't washing hands. But why people don't wash their hands, I think they're in a hurry and they're just running out. Like they do a task for somebody, then they want to run out, or they think, oh, I don't want to use the Purell, I want to use the sink. So I think that's where we're getting into problems. But we have to do further research, and I don't know that there's a lot of studies out there why people don't want to wash their hands.
Do you think COVID-19 is going to change infection prevention forever?
I do. It's a novel virus. We don't know if we're going to get immunity from it. We don't know how long. And I think because it is so virulent and pathogenic, that it has frightened some people. I do know that a lot of people think that it is fake news and that the virus, because they can't see it or because they didn't get it or because they're asymptomatic if they have it. And we won't know that until there's more antibody testing. I don't think people who are unaffected actually believe it in totality, but I do think for the people who have been affected by COVID-19, I think that we will be conscious, and I think people will be fearful to go out without a mask. And I just watch people in supermarkets the other day. I watched this woman clean her cart, and she did it like 3 times before she even put her hand on the handrail of the cart. So I do think it'll change the way people behave.
It's a nasty way to die too, isn't it? I think.
Um, it's people are suffering from air hunger, and then when they get on a ventilator, they may or may not make it. I think it's a 30% survival rate. I believe the latest statistic I saw, and I can't quote where I saw it. If you were on a ventilator, so I do agree with you. It is a nasty way to die.
Any other advice for infection preventionists and hospital administrators? Well, let me circle back to that real quickly. How closely do infection preventionists work with the hospital administration?
I think very closely. My experience has been whenever I had an outbreak of anything in my facility, not only did we generate PowerPoints and put the data in a graphic form for administration to see. We had weekly meetings, we had monthly meetings regularly scheduled for our accrediting bodies and all about infection prevention. But whenever we had an outbreak of anything, we met closely with administration.
Now, the feeling I have with talking to infection preventionists is sometimes I feel like unless there's an outbreak, they're not really, they feel a little bit underappreciated, underutilized. Is that right, or am I off base there?
Um, I think feelings are how you can't control how somebody feels. So if an individual feels underutilized, maybe, but I cannot see in this day and age that a infection control practitioner, would be feeling underutilized, because we still have to look at catheter associated um, infections. We have to look at central line infections. We have to look at C. diff infections. So I think that we are constantly tracking infections in the hospital, and I think that we are actually, doing education. And also, I don't know about feeling underutilized. I have never in all my years felt underutilized.
Um, and you're saying that COVID-19 is going to change, I mean, it's going to make infection prevention even more important. Do you see any big changes coming along for infection prevention? Are you hearing anything?
Um, I can give you what I think is going to happen. Having a background, my master's is in community health. I believe that we're going to go back to, boots on the floor, the descriptive epidemiology. We're going to be tracking people and even all the latest news with easing in restrictions and self-isolation being lifted, I think that we're going to actually be tracking contacts. A number of cities on the news have noted that they will be hiring people in that area. So I do think that we're going to have a bigger role in the community versus just in hospital or clinical settings.
So you think maybe like municipalities will start hiring infection preventionists, or at least have infection preventionists function as sort of like go-betweens with the healthcare community?
I don't know how much with the healthcare community other than providing data. I think it'll be more like the cholera 1800s John Snow actually going out doing the contact tracing and all. So
Okay. Mary Jean Ricci, anything you'd like to add for about COVID-19 and the challenges that we face with it?
in terms of just the challenges, just keep reminding people to wash their hands.